All right, today we're going to take a look at one of the most underrated joints in the entire human body, your elbow. I know, it seems pretty simple, right? It just bends. But it's actually an incredible marvel of biological engineering.
So what is it exactly that makes this joint so special? How can it let you lift, throw, and do pretty much everything with your hands with such precision? What makes it so much more than just a simple hinge on a door? Well, let's dive in and find out.
Okay, so at its most basic level, the science kind of agrees with our first impression. The elbow is technically a hinge variety of synovial joint. Now, the hinge part is obvious, right? It bends and straightens. The synovial part just means it's lubricated with a special fluid to keep everything moving nice and smooth. But trust me, the real magic is in the details.
So what really makes this hinge so perfect? Well, it all starts with how the bones themselves are shaped.
You know, any good hinge only works if the parts fit together perfectly. And that's exactly what's going on here. Your upper arm bone, the humerus, has these two amazing surfaces. The round part, the capitulum, connects to the radius bone in your forearm. And the other part, which is shaped like a spool of thread, is called the trochlea, and it slots perfectly into a little C-shaped notch on your other forearm bone, the ulna. It's two bones from below meeting one from above in two perfectly matched connections. It's just brilliant.
Now, those perfectly shaped bones are great, but they'd fall apart without something to hold them together. That's where ligaments come in. Think of these as incredibly strong straps of duct tape. They wrap around the entire joint from every angle, making sure it's stable and preventing it from wobbling or, worse, popping out of place.
Okay, so the structure is solid. The bones fit, the ligaments are holding them tight, but what actually makes the elbow move? Well, for that, we need to talk about muscles.
At its core, the elbow really only has two main jobs. There's flexion, which is just bending your arm. That's powered mostly by your brachialis muscle and, of course, your famous biceps. Then there's extension, or straightening your arm out, and that is almost entirely the job of your triceps muscle on the back of your arm. It's a classic push-pull system, a beautiful partnership.
All right, now for a part of the elbow you've definitely seen, but maybe never given a second thought to. That little hollow on the inside of your arm. This isn't just some random dip. It's basically an anatomical superhighway.
The official name for this area is the cubital fossa, but yeah, we all know it as the elbow pit. Its simple appearance, though, hides a really complex and absolutely vital traffic junction of nerves and blood vessels. This little triangular space is perfectly mapped out by the edges of two of your forearm muscles. You've got the brachioradialis on the outside and the pronator teres on the inside. Then, if you imagine drawing a line between the two main bony bumps on either side of your elbow, that forms the base of the triangle. And it's not just an empty space. It has layers. The roof is what you can actually touch. It's made of your skin, some connective tissue, and a tough sheet-like tendon from your biceps. And then, way down deep, the floor of this space is formed by a couple of other muscles.
So what's the big deal? Well, what's really important is what's sandwiched between that roof and floor. The cubital fossa is a protected channel for some incredibly important stuff. Major nerves like the median and radial nerves, the main artery that supplies blood to your arm, and the biceps tendon. It's a seriously busy intersection.
And this all leads to its major clinical importance. Lying right there in the roof of the fossa is the median cubital vein. If you've ever had blood drawn or an IV put in, this is almost certainly the spot they used. And why? Because it's held so tightly in place by all that surrounding tissue, it doesn't slip and slide away from the needle. Pretty clever design, huh?
Of course, with anything this complex, there's always the potential for things to go wrong, so let's take a quick look at a few of the most common elbow injuries.
You've probably heard of tennis elbow and golfer's elbow, and people mix them up all the time. But the difference is actually really simple. Tennis elbow affects the extensor muscles on the top of your forearm, the ones you use to straighten your wrist, like in a backhand. Golfer's elbow affects the flexor muscles on the underside of your forearm, the ones you use for gripping. Same idea, just on opposite sides.
And then there's student's elbow. This is just when that little fluid-filled sac right on the pointy tip of your elbow gets inflamed. And yeah, it's usually caused by exactly what it sounds like, leaning on your elbows for too long while studying.
But what about a much more serious injury, like a full-on dislocation? I mean, how can a doctor tell if those bones have actually popped out of their perfect alignment?
Well, it turns out there's this really elegant and simple test. When you bend your elbow partway, the pointy tip, the olecranon, and the two bony bumps on either side should form a perfect equilateral triangle. If that joint gets dislocated, that precise geometric relationship gets broken. It's a super quick and clever way to check.
All right, let's wrap this up by looking at one last, really subtle feature of the elbow's design that actually has a very important purpose. It's called the carrying angle. If you stand up and let your arm hang straight down with your palm facing forward, you'll probably notice that your forearm doesn't hang in a perfectly straight line with your upper arm. It actually angles out to the side just a little bit. That angle is the carrying angle.
So yeah, it's not a perfectly straight 180-degree line. It's closer to 170 degrees. And that little deviation from a straight line isn't a mistake. It's intentional, and it's incredibly functional.
So why is it there? Well, its main job is to allow your arms to swing freely when you walk without constantly banging into your hips. And what's really fascinating is that this angle is typically a little more pronounced in females, which is believed to be an anatomical adaptation for a generally wider pelvis.
So, from its perfectly interlocking bones and supportive ligaments to that vital superhighway of the cubital fossa and its subtle carrying angle, the elbow is so much more than a simple hinge. It really makes you wonder, doesn't it? If a single joint we take for granted is this intricate, what other amazing secrets is the rest of your body hiding in plain sight?